So after liposuction of your flanks, you're gonna wake up and have small incisions sort of below your waistline or hidden in your bikini line. Those will be sewed up with tiny little sutures, 1 or 2 sutures. They'll dissolve or we'll cut them out. There's nothing to really worry about with those. You don't have to do dressing changes or anything fancy. They're tiny little incisions. What you really need to do is wear your compression. So we're gonna put you in compression after the procedure. You can wear Spanx, the garment we put you in. Basically the key is to squeeze down the area treated so that the honeycombed fat underneath will collapse and give you the contour that we want. So initially it's gonna be much thinner because we just sucked out a bunch of fat. But what's gonna happen is there's still fluid in there, there's swelling and inflammation, and without compression, that's gonna grow and grow and grow and get worse. And it will a little bit no matter what. But the compression garments are designed to help keep that swelling under control. And that's why it's important that you don't leave the compression garments off of your body for very long initially, because if you do that, that swelling and that cycle is gonna it can get out of control to where you have a hard time getting back in the compression garment. So do your best to not be out of the garment for very long. You can shower after 24 hours. I tell people to wash their compression garment while they're showering. That way they don't have to be out of it for a super long time. You know, if you're out of it for a couple hours, that's okay. Just put it back on as soon as you can once it's dry. And just kind of keep that area compressed as much as you can. That is the most important thing you need to do after liposuction of your flanks. Showering, like I said, shower after 24 hours, swimming, bathing, submerging your body underwater. In general, I have people wait 3 weeks, but if all you had done was liposuction and your incisions are healed up, I might let you do that after a couple weeks or less. We'll play that by ear. Otherwise, exercise. You can exercise in compression after 1 week. Again, if all you had done was liposuction, you can exercise in compression after 1 week. Just ease back into it. Don't torture yourself. Another thing about healing after liposuction is the tissue is going to feel very firm and half numb. So initially it's going to be bruised and swollen. That lasts about a week, week and a half, sometimes 2 weeks for the bruising to go away. And then you're gonna notice the swelling starts to go away faster and faster and faster the more you wear the compression. And even though the compression is going away and you're a couple, 2-3 weeks out from liposuction, the area still feels really hard to you because you can feel it, it's your body. It's also half numb. That is all normal. I tell people tissue after liposuction feels like half numb cardboard. And that eventually goes away with time. Lymphatic drainage massages can help. Massages can help. But most important thing is time and compression. Wear that compression for the first 2 months. Be patient. It will soften up and the sensation will come back with time. When I had my love handles treated and the extra fat in my love handles sucked out, I don't think my skin back there felt normal for 6 to 9 months. It looked better right away, but it didn't feel normal to me for a while. But I didn't really care because it's not like I experienced the world with my flanks, right? Like we experience the world with our hands and our feet. Those are the things we use to feel the world, not our flanks. So the fact that my love handles were numb and felt a little hard for a while wasn't really a big deal. So I just encourage you not to focus on it. Just know that it'll eventually go away and that focus on the fact that it's not as fat as it once was. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.